Hello. Today's topic of this video is internet gaming addiction. But this particular video is not for the people who are addicted to this gaming, internet gaming, but it is majorly for the parents as to all the parents want actually to give good environment, good food, good clothing, and good education to our kids. But in this way, in this struggle, managing our jobs, our home, the kids, and food, and everything, sometimes we tend to, give in to some things like, we can let our kids watch TV or give them mobile or give them iPad so that, they don't bother us, or we can do our work in uninterruptedly. So but this is the reality, and this is these are the circumstances that we are stuck in. But this video I'm making to ask you, or to help you ask yourself, whether are you contributing to this internet gaming addiction of the child. If yes, then we need to prevent it, and what are the things that we need to think as to what we can do as a parent, so that going ahead our kids don't blame us that you are the one who gave me mobile, you are the one who gave me iPad, and introduced me to all these gadgets and all these different platforms wherein I can engage myself. So that's why I said this video is for the parents, so that they know where they are currently and how this habit can, where it can lead to. Okay, so I just recently read a research which is published in PubMed Central. It's an online journal, Front Psychiatry. The website is Front Psychiatry, and it was published on 5th January 2022. The name of this paper is Diagnostic Contribution of the DSM-5 Criteria for Internet Gaming Disorder. Now, what is DSM-5? When I did my MA in psychology, we were taught DSM-4. There is a list of criteria for different disorders. When you have to label or diagnose a disorder, we need to if the patient fulfills all the criteria listed in DSM-4, then we can diagnose that person, that this person has this disorder. So in now there is a new version of this, which is called DSM-5, and DSM-5 has included a disorder which is internet gaming disorder, IGD. It's a new disorder, and I'll tell you the symptoms, and you will be able to understand whether my child or my youngster or my adolescent or my husband or am I the one who is do I have these symptoms. But don't label yourself immediately that if you see these symptoms that they are present, don't label your child or yourself immediately that I have this disorder, because it has to be a group of disorder, a group of symptoms to get the diagnosis. So leave the diagnosis to the psychiatrist and the psychologist. Don't diagnose yourself. This is just for you to know, or to make you aware as to what is DSM-5 diagnosis for internet gaming addiction. Okay, so there are some okay, so this paper is written by Tao Lu. I don't know whether I am correctly pronouncing this name, but it is Tao Liu and his team. And it lists the symptoms are like preoccupation, like even if the child is not playing or you are not playing the game, and but in your thoughts you're still occupied as to about your game, you are talking about the game, you are thinking about the game, so you are preoccupied. There are withdrawal symptoms. It is just like the alcohol or drug addiction. when you withdraw these things, the kind of withdrawal symptoms, like you get irritated, and your mood gets disturbed, you keep you know you keep, probably you shout, you are not at peace in mind. So these are all withdrawal symptoms. So these are seen, you are not able to focus anywhere. Okay. Then need to spend increasing amount of time, which is also called tolerance. The more you drink, the more the more you drink alcohol, the more time or the more dosage you need to get the kick, or to get yeah, I'm sure you understand what I mean to say. So that is called tolerance, increasing tolerance. So you need more and more of gaming time to get that kick, to get to feel that adrenaline pump. Okay. Then loss of control, to reduce gaming. Now you are aware that what is happening, or how I'm losing on other things. I am addicted to gaming, but you are not in control of it. You don't, you don't you don't have the capability to control your instinct of playing games. Then loss of interest, you lose interest in all other hobbies, like painting, or singing, listening music, or playing guitar, going for a walk, have playing some physical games, cricket or football or anything. So those kind of interest you lose. Then continue despite the knowledge of psychosocial problems, as I said earlier as well, that you are aware that I'm losing on some psychosocial skills, some but still I'm not able to control it. Then use it to reduce negative mood or emotions. Use it as a whenever you feel stressed, whenever you feel you had a fight or something and you are not feeling well, and you immediately switch on your gaming, and you start and you forget the negative emotions. So so use it as a tool to get out of your negativity. Then yeah, then significant loss of relationships, like you're losing your husband, you're losing your the intimate relationship, or you're not spending time with your kids, with your family, with your relatives, with your parents, and all your important significant relations. Then you're losing your job, you're jeopardizing your job, you're not able to clear your exams, so your education is getting hampered because of that. Your career options are uh, getting reduced, you're not getting calls for interview. These are the things which is, so anything to get diagnosis as a disorder, so it has to have a significant impact on your relationships, on your education, on your social circle, on your career, your job. So this is one of the criteria. This paper, it tells us that the presence of this disorder in adolescence is 1.5% to 10% in Western country, so that is Europe, America, and all that, and then 7.5% to 15% in Asian countries. So we have to be really, really watchful as a parent, if in any way are we contributing to this disorder, the development of this disorder in our kids, because I see many parents giving mobile or any gadget so that they can focus on their work, and but slowly this, and which is absolutely normal as well, because there are thousands and thousands of parents who do that, but in moderation, everything in moderation. That is what is important, and that is where we, as a parent, probably make mistake, that we give these gadgets, even though we know that we can manage the child currently, but we are just tired, we feel tired or something like that. We don't prioritize the child's activities. And there are other effects as well of the gadget addiction, which is not listed in this particular DSM-5 criteria, or other gadgets which are not included. It just speaks about the internet gaming addiction. But there is TV addiction, there is mobile addiction, there is iPad addiction. So all these gadgets contribute to this gadget addiction. And the first to 5 years of the child are most important in the brain development, in the structural brain development of the child. So if you are showing your child these gadgets, it will probably, probably affect the brain development. It will affect the speech development of the child. It will affect the educational skills of the child, like reading, writing. Then it will affect an understanding as well. It will affect the concentration span of the child. It will affect the eating pattern of the child, because if the child is watching TV or something while eating, he will not understand because how much he is eating, because his whole focus is on the gadget. So he's not aware as to how much he is eating, what he is eating. So his taste buds are not getting attention. Then he is not able to pay attention if my stomach is full, or I still need to feed myself, or so the kids probably will get obese, and attention span, as I said. Then there are some social skills which the child needs to learn, but he will also lose out on those skills, because the amount of time that the child spends on gadgets is more than the amount of time he spends on all these other things. If this is the scenario, then there is a possibility that your child might get addicted to these gadgets. And this addiction is similar to alcohol and drugs, as I said earlier. So I hope that this video, this information helps you to to become aware as to how much amount of time my child is spending on gadgets, and how much amount of time that child is spending on learning all these different skills. And that is the thing, that's the point of that's the thought that I want to get and become aware about it. So that's all from my side. If you want to read this research article, I will attach the link to this video in the description, and do read it if you are interested. And you can also search for this IGD DSM-5, IGD, that is Internet Gaming Addiction DSM-5 criteria. Thank you for listening.